Okay, this is an MDC 2 Exam 2 review. You need to know your ABGs and the compensations. If the patient has a respiratory problem, you automatically will think acidosis. Hypoventilation is respiratory acidosis. Metabolic, think DKA or diabetic ketoacidosis. If patient is diabetic and has DKA, this is considered metabolic acidosis. If the patient ingested a lot of antacids, they'll have metabolic alkalosis. Diarrhea is acidosis. Treat the cause. You're going to give them an anti-diarrheal. NG tube, alkalosis. Vomiting, alkalosis. Treat the cause, antiemetic. Breathing problems, bronchodilator. Causes of hypoventilation, opioids, rib fracture, respiratory or lung disease. Peptic ulcer disease, if ruptured due to perforation, will present with ascites related to rigid abdomen due to peritonitis. Before discharge of any patient, you need to assess understanding of medications, provide education, do a cultural assessment, and check mental health and emotional support. And if there's a GI situation, you contact a dietitian. If patient has history of taking NSAIDs and presents with vomiting blood, it's a peptic ulcer. The two different types of peptic ulcer disease is gastric ulcer and duodenal ulcer. The duodenal ulcer will feel pain 30 minutes to 2 hours after eating. If a patient is concerned about finances, you're going to refer them to a social worker or a financial counselor. Airways will always be a priority, especially after surgery. Treating GERD, you're going to give them a proton pump inhibitor, which are the medications ending in prazole. After surgery, we don't want to give anything to eat or drink until they have a gag reflex, which shows ability to swallow and have bowel sounds, make a bowel movement, and pass gas. ABGs, the first number to look at is the pH. Then you're going to determine the primary cause. DKA, body compensation, equals Kussmaul respirations. These are fast, deep breathing to get rid of the carbon dioxide, which is an acid. Causes of gastric ulcer, stress, diet, caffeine, H. pylori. You're going to tell them to limit alcohol and smoking cessation. Patient has a bleeding ulcer. The manifestations include red coffee ground vomit, anemia, dizziness and fatigue, weak thready pulse, and low hematocrit and hemoglobin. When examining oral cavity, where are you looking for tumors? Under the tongue. What will increase the patient of getting oral ulcers? This is chewing tobacco and not visiting the dentist. What electrolyte that will be increased in metabolic acidosis? This is potassium, and you're going to need an EKG. Educate the patient with GERD or hiatal hernia to sit upright for 1 to 2 hours after meals. GERD presents. Patient with GERD will present with heartburn, epigastric pain, pharyngitis, and dyspepsia. Dyspepsia is indigestion. The causes of metabolic acidosis is DKA, diarrhea, starvation, seizures, and kidney failure. You're going to educate a patient with cancer to monitor their weight. Lungs control the carbon dioxide, and kidneys control the bicarb. Stomatitis is caused by herpes, dentures, and cancer. If a patient has stomatitis and wears dentures, educate them to not wear the dentures. Candidiasis is oral thrush. A patient that's at risk for this is one that's taking IV antibiotics, and you'll see visual white spots.